Hi everyone, my name is Leontine Alkema and I'm a professor of biostatistics at the University of Massachusetts Amherst. My leadership project focuses on community and capacity building to innovate global and local data use. The context of this project is the estimation and forecasting of health indicators using statistical models. One example is estimation of modern contraceptive use for low and middle income countries, illustrated here for Ethiopia. Models are used by M&E officers for country monitoring and the FP 2030 initiative. A summary of who does what in this area of global health estimation is given in this diagram. The activities range from general statistical model development by statisticians like myself to the usage of model-based estimates by local policymakers and other data consumers. I like to use Bugs Bunny and Brainy Smurf to distinguish between those two sets. While the Bugs Bunnies are data crunchers who are able to easily introduce powerful statistical tools, the Brainy Smurfs provide reality checks and decide what information to use. Now, to obtain realistic model-based estimates that are actually useful and used, we need to extend this diagram with a center, as models need to be built by what I'd like to refer to as an interdisciplinary midfield, to combine statistical modeling with information on use. What this midfield can focus on is, first of all, what to model and how, to actually add value and be useful. Secondly, the midfield also plays an important role in communication to help end users understand the value of model-based estimates. Now, moving on to what motivated my leadership project. While we have many success stories, there are some open challenges to consider. Firstly, while there are good exceptions, to date, the great majority of major modeling efforts are based on a setup where academics or international organizations based in the global north develop models and often also produce estimates. The midfield in particular is typically limited in size as well as diversity. Moreover, people working in this field can do so in silos, for example, based on application domain or organization, even if they struggle with similar estimation and usage challenges. As a result of these challenges, the added value of statistical models is limited, more limited than it could be. Now, to go from the status quo to maximizing the value of statistical models for global health monitoring, I believe that we need to move toward a more interconnected global community of statistical practice in global health, to expand and diversify the community of actors involved, especially in the midfield. And that's where my leadership project comes in, to innovate global and local data use through community and capacity building. In this project, my initial focus has been on figuring out what to prioritize, which I believe is to expand and diversify the interdisciplinary midfield through capacity building. I've started working on this with the Countdown Initiative, which is a global initiative that's focused on improved monitoring of child and maternal health indicators. We started a training and capacity building project with a diverse group of participants. This project includes general training in statistical modeling, model development in a group-based collaboration, and training on usage of the estimates. Now, what I see as a next focus is community building, to aim toward building a community of statistical practice in global health. The main objective of such a community is to improve the local value of data through statistical modeling. Activities to get there can be based on capacity building to expand and diversify our field, for example, through the trainings like the one I just described. We also need to focus on collaborative efforts, for example, to identify lessons learned and open challenges across domains, to learn from one another and work together to innovate. It's not yet clear to me what organizing structure would make most sense for this kind of community, and I would welcome your ideas. I'd like to end with some reflections on my leadership journey. This journey has been incredibly helpful to identify how I, as a nerdy statistician in global health, can move forward to be my authentic self and an impactful and happy leader at the same time. How I'm coming out of this experience is with lots of plans and energy and enthusiasm, which I tried to capture visually in this informal slide. Now, more seriously, this journey has made it clear to me that I would like to put a greater focus on community and capacity building, as that is what I'm most passionate about and that is where I believe I can make the biggest impact. It's also an area where I can continue to grow some of my underutilized leadership skills. Overall, I really value this experience and I am thankful for the learning and the community it has already brought me. I plan to pay it forward in my own way through my continued work in statistical modeling and global health. Thank you for listening to my leadership project presentation, and I welcome your inputs.